Hello everyone, this presentation is on anodyne therapy for neuropathies. Most of you have probably never seen anodyne used in a clinic, but I'm hoping that after this presentation you will have a better understanding of what it is, what it's used for, and then how to actually apply it if you would like in the clinic. Anodyne is infrared light therapy, also called MIRE. It's utilized in 6,000 facilities across the world and is manufactured by a private company called Anodyne Therapy in Florida. It consists of flexible pads that can be applied anywhere on the body and utilizes monochromatic light via LEDs at a wavelength of 890 nanometers. Here's a brief little background on Anodyne. So in 1994, the FDA cleared it for the indications listed below. But then Anodyne actually started marketing for the treatment of other conditions that it wasn't approved for, like diabetic neuropathy, other neuropathies, balance and gait impairments, and then sensation and wounds and ulcers. But then in 2005, the FDA found out about this and issued a warning to their business. So in 2006, Anodyne did change the indications back to the first ones that it was approved for in 94. The indications for anodyne are acute pain and injury, muscle spasms, stiffness and pain, and poor circulation caused by chemotherapy, diabetes, and vascular diseases. So take a look at this picture on the right and look at the lower image. This is a picture of 2 feet. The left foot was treated with MIRE or anodyne and saw a 400% increase in circulation, while the foot on the right was treated with placebo heat and only saw a 40% increase in circulation. So this was a study done, and as you can see, anodyne really did have profound improvements in circulation. So here is the first question for you guys. True or false? Anodyne therapy may be used over or near pacemakers, defibrillators, and metal implants. So pause, think about it, and then the answer is on the next slide. The correct answer is true. Anodyne can safely be used over pacemakers, defibrillators, metal implants, plates, pins, and screws, as well as any part of the body, including the spine. These are some contraindications you should be aware of. Anodyne cannot be used over or near active cancerous tumors, the womb during pregnancy, topical heating or cooling agents or their residuals, as well as pain patches or their residuals. Anodyne is advertised as a hands-free modality, and home units are also available for the treatment of chronic conditions. What is a potential risk we as physical therapists should be cautious of and educate our patients about when using anodyne therapy, especially for patients with neuropathies? So think about what I mentioned earlier about what kind of treatment this is, and then consider the fact that we don't actually have to be present while our patient is utilizing this therapy. And then also consider the fact that our patients will have decreased sensation. So I've given you some hints. Go ahead, come up with an answer, and then see if you were right on the next slide. If your answer was burns, then you are correct. Physical therapists should check the treated area every 10 minutes and should educate their patients to do the same. This is especially important due to the vascular and sensory compromise of these patients. Here are the parameters for anodyne. Pad placement will be discussed on the next slide. The wavelength should be 890 nanometers. The energy control setting should be 6 to 8 bars for increasing circulation. With other conditions such as pain, the energy setting can be as high as 10 bars, but again, with this population with impaired sensation, it would be safer to utilize a lower energy setting. The frequency should be 3 times a week for 12 weeks or until the condition improves, and the time is from 30 to 40 minutes. On their website, they did have a disclaimer that said anodyne therapy is not a cure for patients exhibiting impaired circulation and extremity pain due to a chronic condition, but ongoing symptomatic relief can be obtained from either periodic additional treatment in the clinic or with self-treatment at home. So I think this is important to note that anodyne is not a cure but it is available to offer these patients symptomatic relief. So here are the instructions on how to place the pads on the feet and legs as well as the arms and hands. I chose these two locations because, as we know with neuropathies, the symptoms occur more distally. One thing to note is that as the symptoms improve, we should move the therapy pads proximally to distally. Also, another thing to note is that tingling and pulsing may be felt by the patient as circulation returns to the area. If this causes discomfort, we should reduce the treatment time, increase the frequency of treatments, and move the therapy pads further up the arms or legs. This is the physiology of anodyne or mire. Technically, the mechanism of how mire improves sensation in diabetic peripheral neuropathy is unknown. So what we do know is that diabetic peripheral neuropathy causes decreased capillary blood flow to the tissues and impaired circulation to peripheral nerves. So as a result, they are going to have decreased sensation and distal weakness, as we know. So these are the impairments, and then this is the hypothesis of how mire could work to reduce these impairments. It could increase the release of nitric oxide and improve microcirculation through improved oxygenation and nutrition related to this metabolism. It could also promote nerve growth and then reestablish nerve membrane potentials that had been reduced by the hypoxic conditions associated with diabetes. So, as a result, the goal would be to improve the nerve health and improve sensation and muscle function. So, what does the evidence say about anodyne for neuropathies? Well, I found 5 different studies, and each bullet point on the next 2 slides is representing a separate study. So this first study was actually a systematic review, and it found that anodyne improved sensation, reduced pain, improved standing balance, and then decreased fall risk amongst patients with diabetic peripheral neuropathy. Unfortunately, the study quality wasn't formally assessed, but this is pretty encouraging for future studies that are going to look at anodyne because, well, we know that it has been shown to have positive outcomes. Unfortunately, the second study that I looked at found no statistical significant evidence that anodyne was effective in improving sensation compared to sham treatment. And this was a randomized controlled trial. It was double blinded, and it had a large placebo effect showing that sham therapy, which was just heat therapy, actually had more improvements than those who were treated with anodyne. So, just based on these 2 studies already, you can kind of see that the research is conflicting. And then the next 3 articles that I looked at all did find positive outcomes with anodyne, including improvements in pain, balance, sensation, falls, and fear of falling. But unfortunately, there were some limitations in all 3, and these included outcome measurements, which were just subjective reports. One had a small sample size of 15 patients, one had no control group, and then another one didn't have a comparison with a sham group, so there's just that potential for the placebo effect. So again, as you can see, the evidence is mixed, and I would actually say it's a little bit lower level. So it's not very conclusive to say that anodyne truly will help with neuropathies. So if you do plan to use anodyne, you probably shouldn't say that you're using it for neuropathies because it's not currently an indication for this, but it has been shown to increase microcirculation, which it is FDA approved for. So, as I said before, anodyne has been shown to improve microcirculation, which could impact nerve growth to allow for proper nerve functioning. We're going to be working in clinics, hospitals, and other facilities, and we need to know how to bill for anodyne. Or I guess a better question is, can you bill for anodyne in patients with diabetic peripheral neuropathies as well as other neuropathies? And according to the Medicare and Medicaid website, it states that infrared therapy devices are not considered reasonable and necessary to treat these conditions. So, Anodyne or Meyer is not covered for Medicare beneficiaries for the conditions listed above. So, now it's time for you to use your clinical decision making, which I know how much you guys love hearing that phrase, myself included, but it's true. You have to make a decision based on the evidence, patient values, and our experience, which right now we don't have a whole lot of, but we will as time goes on. So you have to think about the evidence, the current indications, the coverage, as I just mentioned, patient values, as well as what you've seen or witnessed in the clinic. And then you have to decide, would you use Anodyne for the treatment of neuropathies? Think about that. Here's a good summary slide with some takeaway points. Anodyne is FDA approved for patients with pain and stiffness, poor circulation, and muscle spasm. Anodyne increases the release of nitric oxide to increase microcirculation to promote nerve growth. It's not approved to treat patients with neuropathies, but increasing circulation may improve the symptoms associated with this condition. There is conflicting and lower level evidence to support Anodyne for treating patients with neuropathies. And as a result, Anodyne is not covered by Medicare or Medicaid for the treatment of neuropathies.